So welcome everyone to our webinar, Mythbusters, Learn Which Diabetes Facts Are Actually True. This is going to be the topic tonight. My name is Katie, I'll be your host, and Teresa will be our speaker, and I'll introduce her in just a minute. But should you have any technical difficulties, please see the bottom of our screen here. Call Log Me In Support. There is a phone number. Should you have any problems, the phone number is 1-800-263-6317. Let's see, just 1 second while we try to advance the slides.
You can't see it?
Nope, all I see is the first slide.
Not on my screen.
Oh no!
I'm on the second one.
Are you? Huh. Well, I'm probably
Okay.
seeing.
Well, I mean,
I'm probably seeing what everybody's seeing. What do you think? Let's try something really quick. No? Teresa, are you there?
I'm here, but I'm on the second screen.
Okay, see if you just got, there we go. Now we can see. Okay, so sorry about that, everybody. Our program tonight should be a sort of an interactive program, or we hope it will be. So the format includes a short discussion followed by an interactive, it includes a short presentation followed by an interactive discussion. So to type in a question, use the question section of the webinar toolbar, which everyone should see that to the right of their screen. For those that are just calling in on the telephone and not logging on our platform, you wouldn't be able to ask questions, and so we do apologize. But for those logging in on their computer or their smartphone, if you want to ask a question, just type it in the question section of your toolbar, which you'll see on the right-hand side of your screen. So at the end, you'll have a chance to ask questions, and so we do look forward to an interactive webinar. So just a disclaimer, we know that the information you're about to hear may motivate you to make lifestyle changes, so please consult your physician before making any changes to your current routine. This online Q&A session is intended to give general advice. This is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Care and Education Specialist. Our speaker this evening is Teresa Grasso. Just 1 second. Teresa is a registered dietitian and a certified diabetes care and education specialist. She's been working in the nutrition field for over 20 years and has specialized in diabetes care for the last 10. She resides in New Jersey with her husband and 3 daughters. She leads an active life with her family as they are involved in multiple sports and activities. Teresa is passionate about nutrition and leading a healthy lifestyle and enjoys teaching others how to improve their health. So thank you so much, Teresa, for being with us this evening and sharing with us your expertise. And you may take it away.
All right. Thanks, Katie. So welcome, everybody. Thanks for joining us this evening. So as Katie mentioned, we're going to talk about the common myths of diabetes. So here is our agenda for this evening. So we're including those common myths, how to spot a myth, and then again, we will try to open up some questions and some sharing at the end. So just a reminder, talk to your healthcare provider before making any changes to your diabetes treatment plan. All right, so we're going to jump right in. Diabetes myths and truths. So here is our first one. All diabetes pills are not safe. Is this a myth or a truth? So you got it. That is a rumor. Diabetes medications go through extensive testing before the FDA approves them. And it's important to know that certain medications may not be good for everybody. So, depending on your personal health history, what other medications you may be on, there may be ones that don't work for some people. And that's just having that discussion with your doctor. There are so many different diabetes medications. So sometimes it's a little bit of trying different ones to see what might be the best, or making sure they don't interact with any of our other medications. And then there could be some side effects, but according to the FDA, most side effects are not serious and they go away on their own. And you just want to make sure you're talking to your doctor, immediately if you're having any side effects or any concerns. So there could be an instance, maybe the medication is making you feel nauseous, or, upset stomach. So that's something, keep a record of what's going on. Um, Look closely at your medications, if they should be taken with food, without food. Some need to be taken 30 minutes before a meal, some need to be taken with a meal. So it's important to go over your exact prescription. And if we're on multiple prescriptions, sometimes we can get confused, right? Because some of them might be once a day, some are twice a day, some are morning, some are night. So it's really important, maybe make a list of your medications, when they should be taken. If you're unsure, definitely review that with a doctor, review with your pharmacist, any side effects and any questions on how to take your medications. So our next myth or truth: taking diabetes medications means you failed at diabetes. All right, so that is definitely a myth. So there are people who get very discouraged if they have to start a medication. Maybe we start out, doctor tells us we have pre-diabetes. Maybe we find out our A1C is up a little bit and we want to try with diet and exercise. And that certainly is a great thing. And there can be people that, are able to control with diet and exercise only. Um, some people may be able to control with diet and exercise for a period of time, and then they may need to go on medication. But by no means does that mean that that person failed at, controlling their diabetes, because over time our body starts producing less insulin. So insulin is what helps us keep our blood sugars down. So insulin is produced in our body, and after we eat, what insulin's job is it gets that sugar out of our blood and brings it to our cells, where our body uses the sugar from our food for energy. So over time, when we have diabetes, we have pre-diabetes, our body starts producing less insulin. So there may come a time that we eventually need that medication to kind of help insulin do its job, to kind of help our body do its job, because our pancreas may not be able to keep up with our body's needs. So it's not a failure at all. It might just be it's a tool that's going to help keep those blood sugars down, because a bigger problem would be high blood sugars and how it over time can cause a lot of complications on our body. So medication a lot of times is needed to control those blood sugars. So you can see this kind of just gives us a little graph and an idea. um, blood sugar levels are normal, insulin production is good, the insulin resistance, they're all kind of pacing the same in those normal levels. With pre-diabetes, we can see there's a little bit of a shift, right? We have more insulin resistance, which makes those blood sugar numbers come up a little more, and we have a decrease in that insulin production. Not so much in the pre-diabetes range, but then you can see a bigger shift when we go into the type 2 diabetes range. So again, those medications are needed to kind of close those gaps and make sure those blood sugars aren't going too high. Okay, a myth or a truth: diabetes medications will cause me to go blind. So that is definitely a myth. Our medications are going to help manage our diabetes and help keep our blood sugars under control and within range. Keeping our blood sugars within range is going to help our eyes, is going to protect our eyes. So we want to make sure we have blood sugars that are within range because that's going to decrease the complications. We all know that a complication of diabetes can be some eye damage. So that's why it's so important. We keep up with our doctor's appointments. We get our eyes dilated and they're going to check, make sure that blood sugar and that diabetes isn't affecting our eyes. But the biggest way to protect our eyes is keeping our blood sugars under control. And that a lot of times would mean that we need to make sure we're taking our medications. If there comes a time that, insulin is going to be added to our regimen because we know we need that to keep those blood sugars under control, we need to kind of do that to help with protecting our eyes. Okay, so myth or a truth, I can stop taking my medication when my blood sugar is normal. So we hope that we're getting to the point that our blood sugar is normal, but that does not mean that we can stop our medication. So our medication is helping to keep our blood sugar in a target range. So we want to kind of think of our treatment as like a three prong approach, or like if you have a triangle, we have 3 points, right? And those points for our diabetes management are going to be our diet, right? We need to have a healthy diet, a carb controlled diet to help with our blood sugar control. We need to get exercise in because exercise is going to help with our diabetes management and our blood sugar control. And then our third point is going to be our medication. So our goal is those 3 things working together to help keep those blood sugars in a normal range. So when the blood sugars are in a normal range, that means those 3 things are doing their job, and you're doing your job by taking the medication, by eating healthy, and by exercising. So if there comes a point that maybe the blood sugars are on the lower end and maybe you had lost some weight, say, or maybe you changed your diet a great deal and things are working out great for you and those blood sugars are coming down, that would be a discussion with your doctor. They'll check your blood work, they'll check your A1C, they'll look at your numbers, your self monitoring blood sugar numbers you're getting at home. And then it might be a determination to say, okay, you're doing really good. Maybe we can decrease the medication. Or maybe if we're on multiple medication, the doctor will be able to take you off of something. But it wouldn't be something that we would do on our own because we need that blood work. We need to look at the overall picture to see what is going to be the best plan for you. So that would always be a discussion to have with the doctor. Keep checking those blood sugars, keep a good record because that's what's really going to show your blood sugar trends. And if there's a case that those are going too low, or maybe there's a case that they are in that perfect range, the doctor may discuss with you making some changes to your medication. Okay, next we jump into a little diet question. So, a myth or a truth, carrots and beets are high in sugar and should be avoided by people with diabetes. Okay, so that is a myth. I know we all probably hear about certain foods, or if we just talk about fruits and vegetables, certain ones that people may say are not good for us. But really, carrots and beets are low in carbohydrates. Our non-starchy vegetables are not really going to affect our blood sugar unless they're eaten in very large amounts. So if we take a look at that little chart there, starchy vegetables do contain more carbohydrates. So if we look at that chart there, if we were talking about those carrots and the beets that we just mentioned, so the portion 10 carrots or half a cup of beets is about 8 grams of carbohydrates. If you compare that to a starchy vegetable, such as corn or peas or your potatoes, a half cup portion of those starchy vegetables is about 15 grams of carbs. So those would be in line with a carb serving, like a slice of bread, a third of a cup of rice or pasta, those all also have 15 grams of carbs. So our starchy vegetables do have a lot more carbs in them, but when it comes to things like carrots or beets, yes, they have carbohydrates, but they're not going to be as large of a quantity as those starchy foods. So the bottom line is really we can fit any of these foods in our diet. So we can still fit in peas and corn and starchy vegetables, but we're going to look closely at our portions. Same with those carrots and those beets. If I eat, a small portion, half a cup of beets, I'm only getting that 8 grams. But let's say I decided to have a cup of beets, then of course I'm getting more carbohydrates. So bottom line is when we eat, it comes down to those portion sizes. So especially when we're talking about these carbohydrate rich foods, those we have to watch our portions a little closely because that's going to add up and affect our blood sugar. Okay, so our next myth or truth is people with diabetes should not eat fruit because it contains too much sugar. All right, so definitely that is a myth. Again, you probably will hear that there are people who say certain fruits have too much sugar and I have diabetes and I can't eat those. But I want you to know that people with diabetes can enjoy fruit. Again, it goes back to those portions I, just talked about with our last slide, because we need to make sure we're watching those portion sizes. So we would want to spread out our servings of fruit in the day. So, generally a small piece of fruit. So think of size of a tennis ball. So if we thought of like an apple, an orange, a peach, a pear, that is around the size of a tennis ball. That's about the 15 grams of carbs. Now, if we think about fruit that's a little larger, whoops, sorry. So fruit that's a little larger, maybe a banana or a mango. Those are a little larger. So generally like a half of a serving, a half of that piece of fruit is a serving. So a half of a banana or a half of a mango would be around that 15 grams. Summer months are coming around. Berries are in season. So those you actually get a pretty big portion, 3/4 a cup of berries or a cup of blueberries. A cup of strawberries is a serving. Grapes, sometimes people say grapes, they're so high in sugar, but again, it's the portion. So we don't want to sit down with the bunch of grapes and eat half the bunch. Then of course we are getting a lot of carbs. We are getting a lot of sugar. Our grapes, we need to portion it out. 12 to 15 small grapes is a serving. So maybe that's not going to be the greatest snack. 12 grapes, I'm hungry, so sometimes pairing fruit with a little protein. So maybe I have my 12 to 15 grapes and I have a 1/4 cup of unsalted nuts with it. Or I have my half a banana with a tablespoon of peanut butter. So it all comes down to those portion sizes. And as long as we don't eat a large amount of fruit at once, then that is what we're going for. So if we had a piece of fruit, say, in the morning between breakfast and lunch, and then maybe we have a piece of fruit in the afternoon between lunch and dinner, pair it with a little bit of protein, that is a perfect snack for you. Okay, so our next diabetes myth or truth is that people with diabetes should only eat diabetic food. So that is a myth. I'm not really even sure what diabetic food is. So we want you to definitely know people with diabetes can eat any food. We're always looking at eating that food in moderation. So there's no special or diabetes foods that are needed. Again, it comes down to those portion sizes. So when we talk about, some people might say, oh, I eat sugar-free cookies. So guess what? Those sugar-free cookies also have carbohydrates. So even though you think like that's a diabetic food and those cookies are better for me because it says sugar-free, when it comes down to it, it's always going to be the portion. So you would look at that food label, you look at the serving size, maybe it says 1 cookie, maybe it says 2 cookies, and then we would look at the total carbohydrates. So most of those things like cookies or a pie or ice cream, you know, any of those things that say sugar free, they're still going to have carbohydrates in them. So we're still going to watch our portions. So a lot of times, you know, maybe we want to treat ourselves occasionally. We're not eating these things every day, but if we wanted to have a regular cookie, we can certainly fit that into our diet, but we are trying to look at the portion size and we're making sure those carbs are in line with our meal plan. So there, you know, is no special foods. It really is going to come down to portion sizes. So we want to just be careful of misinformation and inaccurate information. Um, so if you ever see anything listed where they say this is a list of good foods and this is a list of bad foods for diabetes, that's usually going to be inaccurate, right? Because our goal is that you can fit most foods into your daily meal plan if you have diabetes or not. So yes, we want to stay away from things that are loaded with sugar. So when we have diabetes or even the general, you know, general people who don't have diabetes, we want to stay away from things like sodas and excessive juices, excessive sweetened beverages. So those might be something I would say, okay, this isn't the best thing for me. But I don't want to look at lists of foods that have good and bad foods because my goal is including all foods, and especially if there's a certain food that you love, maybe it's a little high in carbs, but the goal is to try to fit that into your meal plan. If it's high in carbs, maybe it's something we don't eat as often, but we can try to fit that in the appropriate portion. We want to be aware of things that promise to cure diabetes. Unfortunately, there's no cure for diabetes. We can control our diabetes. We can get our A1C down to, you know, below diabetes range level, but we don't really get rid of diabetes. You know, if we have it, we still need to watch what we're doing. We need to look at those points, our diet, our exercise, our medication if we're on it. And we want to just keep up making sure we keep it under control. Even if it goes down to a level below the diabetes range, we still have to kind of monitor and make sure, you know, those numbers aren't creeping back up. You want to be careful of websites you may go to get information. So make sure they're, you know, sound websites, American Diabetes Association, American Heart Association, the Academy of Nutrition and Dietetics. You know, you just want to go to good sites and not just kind of random Google searches that might send you on a spiral of misinformation. If there's any claims that sound too good to be true, to help you improve your blood sugar levels. Like I'm sure, you know, you probably see a lot of them. You might get some certain ads if you're on Facebook and those kind of places. You know, if it sounds too good to be true, if they're trying to tell you there's something that cures your diabetes, it's usually something that's false. If you see any recommendations based on a single study, you know, sometimes there might be something, oh, 3 people took this and their diabetes is lowered, their blood sugars. So, you know, okay, what else were those people doing? So we don't really take into account something that's, you know, just a single study that really doesn't look at a lot of people and a lot of things that they're doing to keep those blood sugars down. And if anything promises to be a quick fix, all right, we know that diabetes is not easy. So none of us thinks that this is an easy disease and, you know, oh, you just eat healthy and you're good. No, we don't think that. We know it's hard. We know it's a lot, checking blood sugars, keeping up with appointments, you know, eating healthy, exercising. There's a lot that goes into it. And, you know, nobody's perfect. You know, we might have bad days. We have our good days too, though, right? So there's no quick fix. It is, you know, the long haul of doing all the different things to keep it under control. And then hopefully you have a good team behind you. So, the coaches here at Cecilia Health are great, and we're here to support you and hope that we can help you feel under control with your diabetes rather than looking for some quick fix. Okay. So just in summary, we know that our diabetes medications, we take them to keep us healthy. We take them to keep our blood sugar under control. And in turn, our blood sugar being under control is going to prevent or help prevent complications that can happen with diabetes. We want to make sure we're always taking our medication as the doctor prescribed them. So if you ever have any questions, if things get confusing, make sure you bring that list of medications to your doctor, your pharmacist, go over them, make sure you know when you're taking each one and what your specific medication plan is. And we want to remember that all foods can fit into our diabetes meal plan. So some we might have to eat in more moderation, those that are high in carbs, but we want to be able to fit those things in. So portion control, serving sizes, being aware of what counts as one carb serving is so important so you can see, how those carbohydrate foods fit into your meal plan. And you want to talk to your healthcare provider, if you read anything about diabetes, if, maybe you read something and you just want a little more information, talk to your healthcare provider, see what they think about it. And you can kind of go from there to decide if whatever you're reading is something that's good for you. Okay, so we do want to open it up to any questions. I'm just going to look and see if there are any currently. If you do have any questions, feel free, type them into that question box and we can kind of just get started with any questions anybody might have. Oh, I think there is one here. I always have trouble reading them, so just give me a minute. How does apple cider vinegar Okay, how does apple cider vinegar impact the blood glucose and recommendations on that? Unfortunately, I don't really know a lot about that. Um, that apple cider vinegar is well, it's funny, I just had this discussion about something else about that with reflux, but it seems to be a hot item right now. There's always different things, that go through the media and TikTok and whatever else is going on, and apple cider vinegar is a hot point right now. I've heard people taking it more for helping with weight loss. But for blood sugar recommendations or control, I have not heard anything about that. So I would maybe talk to your doctor about that, or maybe your Cecilia Health coach would know a little bit more. I do know you want to be very careful. Apple cider vinegar is acidic. So if you are taking shots of it, which I know some people do, you have to be real careful because that you're, taking that acidity into your esophagus, is not always the best thing for us. So, review that with your doctor. You're welcome to write to me how you heard that helps your blood sugar, and maybe I can answer that. All right, if anybody has any other questions. Okay, and somebody is asking about exercise and blood sugar control, how that helps keep our blood sugars down. So when we do exercise is going to help the body use insulin better. So whether it's the insulin our body naturally makes or the insulin we may be taking for our diabetes, what exercise does is helps your body utilize that insulin. So what it does is help the body get that sugar out of our blood and bring it to our cells where our body uses it for energy. So what we recommend is trying to get at least a 30-minute walk in a day. Some people may be able to do much more exercise than that, and that's great. But walking is really, really good for us and good for our blood sugar control. So trying to get about 30 minutes a day is a good idea, even if you split it up. So if you can only do 15 minutes in the morning, 15 at night, that's great too. Just trying to work on getting our body moving. Okay, I have read that cold cooked potatoes have less carbs than baked or boiled potatoes eaten warm. Therefore, potato salad is supposedly better. That sounds like a big myth. Um, whether the food is cold or hot is not going to change the carb content, unfortunately. So when we think about potatoes, whether they're mashed, cut up, baked, cold, about a half a cup is what's going to have about 15 grams of carbohydrates. Um, with a potato salad, we have to look at, maybe some of the other things that are in it. So if a potato salad has mayonnaise, mayonnaise in it, salt in it, whatever it is, obviously that's not going to be the best thing for us when it has those added fats or added salt. So again, doesn't mean we can't have it, but here I'm looking at my portion control, right? I want to keep it to about a half a cup. If I'm eating a baked potato and I don't have, maybe I roasted the potatoes, say, and I have half a cup of those, that might be a little healthier if I use a little olive oil versus like the mayonnaise that was in my potato salad. Or if I do a half of a baked potato and I ate that plain, that might be a little bit healthier. So remember, around a half a cup is what is your serving, and that's around 15 grams of carbs. Some potatoes might be a little more denser than others, so we may be getting a little more or less just depending on that. But if we estimate about 15 grams per half a cup, that's ideal. And then maybe when we think about the potato salad, maybe we had some celery in it and some carrots. So maybe in that half a cup, we're also getting some vegetables. So that could be, a point for potato salad. But when it comes down to it, portions. Okay, so half a cup would be the portion. So if you're going to a barbecue, enjoy your potato salad, but keep it to a half a cup. All right, thanks so much for the questions. Okay, what is the recommended? Okay, wait, hold on, I lost it. What is the recommended number of carb points per day? So our carbs would, we try to personalize it, but for the most part, about 3 carb servings per meal is a good place to start. So for most women, about 3 carb choices per meal. Men sometimes can go up a little more to about 4 carb servings per meal. So, just to make that make more sense if you're not don't know the portions. So a carb serving is about 15 grams of carbs, right? And then if we're doing 3 carb servings at a meal, that's about 45 grams of carbs at your meal. So if we just took breakfast, for instance, and we were keeping it to 3 carb servings or 45 grams, that could look like 3/4 of a cup of Cheerios with a cup of milk and a half a banana. So the 3/4 cup of Cheerios would be 15 grams, the cup of milk would be 15 grams, and the half a banana would be 15 grams, and there's your 45 grams. So generally around 3 per meal is a good place to start. 3 carb servings per meal. And talk to your diabetes educator a little bit more about that so you would know what's specific for you. But we never want to look at it at just per day, right? Because just like we've talked about in this presentation, we want to make sure we're spreading things out. So if we said, oh, you can have 150 grams of carbs per day, you can't think like, oh, I'm going to eat, 100 of them now, or I'm going to skip a meal so I can eat more later. No, you want to think of spreading them out throughout the day. So if I do 45 for each meal, I'm spreading them out. Whenever I eat too many carbs at one time, then my blood sugar is going to go up. If I can kind of spread them out and eat them, spread out throughout the day, the goal is that that will keep my blood sugars more stable. Okay, why does my blood sugar crash after a meal, especially a larger meal? Okay, I mean, that can be different reasons. Could come into play your medication you're on. So our blood sugar shouldn't be crashing after we eat. So I would definitely talk to your doctor, because maybe if you're on insulin, or if you're on one of the oral diabetes pills that can cause low blood sugars, we'd want to look at that, because maybe your dose is too high and that's why it's crashing. You want to kind of look at what is your definition of crashing. A low blood sugar is 70 or under. So a low blood sugar of 70 or under is in the danger zone that we'd want to treat our blood sugar. And when we say larger meal, what was in that meal, right? Was it, if it was high in carbs, you generally wouldn't crash, but sometimes people have like what's called reactive hypoglycemia. And if they do eat things that are high in carbs, it kind of has the reverse effect on them, where their blood sugar drops. So I think this would be something that you really need to keep a food diary and keep a diary of your blood sugars to really see, what's triggering those drops. Is it the medication? Is it the food choices? So a good journal of what you're eating and what those blood sugars are is the way that's really going to delve into that and figure out what's going on for you. Okay, I'm trying to see if there was any other questions. Okay, if anybody has any others, just go ahead and drop them into the questions section before we end. Okay, and I did want to tell you about our upcoming live events. So, if you're interested in any of the live events, let your diabetes coach know. They can send you a schedule, but our next one is on July 13th. They're typically once a month, um, and the times may vary, so just check out the time. So the 13th is at 6 also, diabetes and your diet, taking it to the next level. And then in August, it's at 7, and we have blood sugar boot camp, and that would go over the ins and out of blood sugar testing. So those are the next ones coming up. And then remember, you have additional resources at Cecilia Health. So we have our Facebook group. So that's the link, but it's Diabetes Innovation. So you can look that up on Facebook. We post a lot of really great articles and things to kind of read over, which is nice. We also have our Cecilia Health blog, which is great. A lot of different topics, a lot of relevant new topics. A lot of times you can get some good recipes and just, things about exercise, or, whatever might be going on to help you with not only diabetes, but heart health, mental health. So definitely check that out. So if you go to ceciliahealth.com, you can go to this exact one with the blog there on the end. But if you do go to ceciliahealth.com, just scroll all the way to the bottom of the website and click patient resources, and then you'll be able to find our blogs and also our webinars. So the webinars would be on there, and there's also a library of webinars. So if you ever wanted to listen to past webinars, those would be on there too, and you can listen in. All right, I'm going to check one more time to see if there were any questions that came through. If not, I will let you guys go for the evening. I don't see anything else, so I want to thank you for joining us. We really appreciate your attendance, your participation. Those were great questions. If you have any other questions, feel free to definitely reach out to your diabetes health coach. Any questions on your medications or anything, or things that we went over that kind of sparked, like, okay, I'm gonna make sure jot that down to ask your doctor about it. All right, I hope everyone has a great evening and has an awesome summer. Thanks for joining. Take care.